Good morning, everyone. I'm Laura with the Livingston County Chamber. I think I had a chance to pop in and see everyone this morning, and I want to welcome you to our presentation on the New York State Department of Labor HERO Act update. We are very fortunate to have Frank Urban with the New York State Business Council with us here today, and we've had Frank out actually in Livingston County and as well as on webinars. The Business Council is always fantastic in providing our membership with the most up-to-date information on topics that are very relevant to your business. And I think today's presentation is a clear example of that. We are recording the presentation and it will be available online afterwards, and we'll send you out an update in case you just want to review the information or have additional questions. Along the left-hand or right-hand side of your screen, you should see a chat feature, participants, Q&A. You can pop your questions in there in either the chat or the Q&A. We'll be monitoring that throughout the program, and we will address the questions at the end here in present mode. And then when we go back onto the floor, if you have additional questions, Frank will be at a table and you can pop over to his table and, just like if we were in person, ask your questions. So I will, with that, turn it over to Frank. I'm going to turn my screen and microphone off. However, I will still be here, and the floor is in Frank's hands.
Okay. Thank you, Laura. I'm going to share my PowerPoint presentation because what's a good program without a PowerPoint presentation? And Laura will tell me if I have done that. Okay. All right. Well, thanks everybody for having me. I appreciate it. It's always a great pleasure to try to get this information out to as many employers as possible. We're going to talk about the HERO Act, an act that was designed to try to prevent the spread of airborne infectious disease as dreamed up by the legislature. What happened is apparently back in February of this year, the legislature was, I think, afraid that the New York Forward industry guidelines that we were all operating under during COVID would go away, and they wanted something in place to protect workers going forward. They came up with this law. We, the Business Council, have been working on this for a long time, and I can give you an update as to where we are now. First thing I want to mention is I'm not an attorney. There are times when you're going to want to speak to an attorney, especially when we get to the later parts of the HERO Act. You're certainly going to need some guidance if issues arise. For those of you who don't know, the Business Council is the state chamber of commerce and the state's manufacturing association. We are the largest statewide business organization in New York State. I'm located in Albany. I'm part of the government affairs team. I'm not an attorney. I'm an HR professional. I have sort of a dual role with the Business Council that I advocate for businesses on labor and HR issues, and I provide sort of an HR consulting service to Business Council members. About 60% of our members have 50 employees or less, so they really don't have their own HR professional on staff. We provide a lot of those services for them. But in this case, I'm a lobbyist in that regard, and we advocate on behalf of businesses. As I said, I do labor and HR, but we have the largest in-house lobbying group in Albany, New York. We have experts on environment and tax and finance and healthcare and transportation, manufacturing, lobbyists who have expertise in each of those areas and can be a helpful resource to our members. So what is the HERO Act? It's the Health and Essential Rights Act. If you put an O at the end, it makes it impossible to veto, apparently, as we will get into the politics of this a little bit. But it's a new obligation of employers to do two significant things. One, you have to adopt an industry-specific airborne infectious disease exposure prevention plan that has been developed by the Department of Labor in conjunction with the Department of Health. First thing we're going to have to do is develop and adopt a plan. The second thing that is probably more difficult and more concerning is that regard workplace safety committees. Employers with at least 10 employees shall permit employees to establish and administer a joint labor management workplace safety committee. We'll talk about that at the end. There are some dates we need to be aware of. First of all, regarding the airborne infectious disease plan, the bill was signed in May by the governor. There were some amendments made to it, amendments that the Business Council was key in getting done, that passed in June. It was signed into law and became effective on July 6th. July 6th was the deadline for the Department of Labor to release industry-specific standards and templates that businesses could adopt as their airborne infectious disease plan. They did that, and I'll tell you how to find those. Once those templates have been released, then employers have 30 days after that to adopt the plan. That means August 5th is a deadline that's coming up for all employers. And then we have 30 days after that to communicate our plan to employees. And we'll talk about what all these terms mean in a second. The workplace safety committees, as I mentioned, is going to be a little more difficult for employers to comply with. That portion of the law does not take effect until November 1st of 2021. So that's why we're sort of pushing that off a little bit for later on in the summer. Let's first deal with the exposure control plan we have to adopt. All right. So who does the plan cover? It covers every employee, independent contractor, as well as any individual working in your office, right? Think of this as OSHA. We have an obligation to maintain a workplace free from hazards, right, that can cause serious injury or illness. That involves our workplace. So think of it less as who is covered as opposed to where is covered. We're responsible for our workplace. And it says specifically that we're responsible for every work site over which we exercise control. So if we have company vehicles, if we have employer-provided housing, we are responsible for providing a safe workplace in that area. There are things that are frequently out of our control, right? If we are a home health agency, let's say, and we send our employees into the homes, private homes of our customers, we're not responsible for making sure that environment is free of airborne infectious disease. We have to take certain steps to protect our employees, but we're not responsible for that work site, okay? As you see, the plans are going to have requirements for health screenings, face coverings, personal protective equipment, all the stuff we've been doing for the last 18 months as we've been operating under the COVID New York Forward industry guidelines. So it's a lot of familiar language, a lot of familiar things that you'll see need to be included in the plan. There are penalties for not doing this. There are fines and penalties for not having a plan, not communicating it effectively to employees, and for violating the portions of your plan if you willfully do that, including injunctive relief, meaning they can go and get an immediate decision from a court to make you change your behavior. The good news is that there was initially a private right of action which said employees could sue you for failing to do this. We were able to get that removed. Now there's a 30-day cure period, meaning if an employee comes to you with a safety concern related to airborne infectious disease and you do not address it or cure it to the best of your ability within 30 days, then that employee can go to the Department of Labor and look for enforcement action against you. So if an employee comes to you with a safety concern related to the spread of airborne infectious disease, let's address it right away. Let's not ignore it, because after 30 days, now they're free to go externally to the Department of Labor for relief. So there's a website. As you might have noticed, the Department of Labor, when they have these new mandates on employers, they don't make necessarily a big announcement. They don't reach out to employers to any degree to let them know this is in effect. What they do is they put up a website. You saw this with sexual harassment, right? There was a website put up for that. There's one for paid family leave. You've probably been to all these websites now as you've needed to, as the situation arose. Well, now there's one for the HERO Act. It's dol.newyork.gov/New York HERO Act. So go there and get familiar with the contents of that page. And what you'll see there are several things. First, you'll see the Airborne Infectious Disease Exposure Prevention Standard. All right, so what the Department of Labor was forced to do by this legislation was sort of to become an OSHA in regard to airborne infectious disease. So they adopted a lot of the practices that OSHA does. And the first thing they did was develop a standard. Those of you who are in an industry where OSHA standards apply, perhaps you have dangerous chemicals, or you have respiratory protection that's required, or ear noise protection, things like that. You're familiar with OSHA standards. They carry the weight of law, and it tells you what the rules are, right? Here's what you have to do as an employer. So they developed a standard, and you can find the standard on this webpage. Then they gave us a model airborne infectious disease exposure prevention plan. This is a model that any industry could use. It's generic. It's a model generic plan. In addition, they gave us some industry-specific templates, some models that are model plans that are geared towards specific industries. And this list you see on the screen here is the industries they came up with. And you're going to see it's a little bit different than the New York Forward guidance. There's not one for office environments, for example. So if I have an office environment, which one do I use? I'd probably steer you towards the model plan as opposed to any one of the industry-specific templates. What if I have a combination of services in my workplace? I have delivery services. I have some construction. I have some office environment. What do I do? Which template do I use? Well, what you're going to have to do is go through these different templates and incorporate the different aspects of each of these templates into your specific company-wide airborne infectious disease plan. You may find yourself in a situation where there is no specific template for your industry. You're going to have to develop that plan on your own. Okay. So the good news is, so one of the benefits of the Business Council as being the largest business organization in the state is that the regulators come to us for input, right? Before these standards were released, I got to work with the Department of Labor on helping make these a little more business friendly. And in this case, I think they did a good job. They listened to our suggestions, and I'll give the Business Council a pat on the back for our efforts on doing this. We made some significant changes from the initial standard to the final standard that I think are beneficial to business. In fact, the department worked on these over the 4th of July weekend, and we spent a lot of time over that holiday weekend listening to fireworks and the Department of Labor at the same time. The good news is they use OSHA language. They talk about engineering controls, administrative controls, and personal protective equipment. And those of you who are familiar with OSHA know that this is the order in which we go to try to remove a risk, right? If there's a risk in the workplace and cause harm to employers, the first thing we have to do is engineering controls, try to remove the risk. In this case, if it's an airborne pathogen or an airborne infectious disease, we have to engineer it away. How do we do that? We can either change our ventilation system to accommodate that. There are engineering controls to make the risk no longer there. If we can't engineer away the risk, and there are risks that cannot be engineered away, right? If you're working in a hospital, you can't avoid blood, in the workplace. So you have to go to the next level, and that's some administrative controls. You write rules that will protect employees from an airborne infectious disease. So that's the things we've seen under the New York Forward industry guidelines, right? We had 50% occupancy. We had, washing hands. We had staggered shifts. We had those types of rules to try to protect employees from any airborne infectious disease. And then the last line of defense, because even those two efforts might not solve your problem, the last line of defense is personal protective equipment. And that's masks, gloves, gowns, things like that. So the good news is that the model standard uses OSHA language that employers are already familiar with, and we'll get into some of the details of that in a second. It applies to your employers with work sites located in New York State. You're not obligated to provide this plan for your out-of-state employees or different work locations you have outside of New York State. It's only an airborne, it's only in effect, the plan is only in effect when there is an airborne infectious agent or disease designated by the Commissioner of Health as a highly contagious communicable disease that presents a serious risk or harm to the public. There is no such current designation. So while we're all dealing with the leftover effects of COVID, we read yesterday about the CDC with some new guidance regarding masks for vaccinated people. Currently in New York State, there is no such designation by the Commissioner of Health. Therefore, this plan we're designing, we're going to create this plan. We're going to get it together by August 5th. We're going to communicate it to our employees by September 4th. It goes on a shelf right now. It is not in effect at this moment, okay? So we're going to get the plan written. We'll talk about the specifics of that. We're going to put it on a shelf, and we're going to wait for the next designation from the Commissioner of Health that will activate the HERO standard plans. It does not apply to any employees of the state, any political subdivision of the state, towns, municipalities, public authorities, or any governmental agency. And it does not apply to any seasonal or endemic infectious agent or disease, such as the seasonal flu, that has not been designated by the Commissioner of Health as a highly contagious communicable disease. Our fear was that airborne infectious disease is a broadly defined term, right? It could mean anything. It could mean the flu, it could mean the common cold. Are employers going to have to activate their plan if an employee comes to work with the common cold? You do not have to do that. This is only for serious contagious communicable diseases that present a serious risk of harm to the public health. Now, I guess it's conceivable, and when we talk to the Department of Labor and the Department of Health about this, that we could have a flu season that's significantly worse, that has a strain of flu that could be more serious than others. If that's the case, then the commissioner will designate it, and we'll have to take our plan off the shelf and put into effect the portions of the plan we need to do. It does not apply significantly to any employee who is covered under a temporary or permanent standard adopted by OSHA regarding COVID-19 or airborne infectious agents or diseases. So this was significant. If you look back on that list of templates they created, you notice there were none available for healthcare. And you wonder why. It's a big segment of our economy. We have a lot of workers in the healthcare system in New York State. Why wouldn't the department put in place a template for healthcare? Well, it's because on June 21st, prior to them releasing their standards, OSHA designated an emergency temporary standard that covered healthcare regarding COVID-19. Now, that's not all infectious airborne agents and diseases. It's only for COVID-19, the OSHA standard. And that's in effect now. Well, who does that cover? So the OSHA emergency temporary standard applies to COVID-19, covers employees in hospitals, nursing homes, assisted living facilities, emergency responders, home healthcare workers, employees in ambulatory care facilities, anywhere where suspected COVID-19 patients are treated. So if you're one of those industries, you have an obligation under the emergency temporary standard to do certain things. And one of those things is it requires a written plan if you have 10 or more employees. So you need to write a plan for OSHA. You need to write a plan for the HERO Act. Do I need to write two separate plans? You could if you want. If you think that's ease of administration, you would have one for COVID as required by OSHA. You would have one for all other airborne infectious diseases, including COVID, under the HERO Act. Or you can put these together and make one plan that meets the obligations of both. And I've talked to a lot of healthcare employers, and they've done just that. They've taken their COVID ETS plan, the Emergency Temporary Standard Plan, and they've incorporated the HERO Act provisions in there regarding other airborne infectious disease. So while technically as a healthcare employer, you're not covered by the HERO Act, if you are covered by the Emergency Temporary Standard from OSHA, remember that there could be differences. Our next airborne infectious disease pandemic could be something other than COVID. And if that's the case, you're going to need to have a HERO Act plan in place. So I know that's confusing for healthcare providers and double the work for healthcare employers, but that is where we're at now. So what does the standard require, the HERO Act standard require? It requires a written plan. You can adopt one of the templates that are in there or the model plan that was provided by the Department of Labor. If you look at those plans, you'll see it's pretty easy to fill in the blanks. You can copy and paste that plan and put it on the shelf and wait for the next emergency to occur. You could create an alternative plan if you don't like the one the state provided you. The issue with that is the statute requires that if you create an alternative plan that's substantially different from the template the DOL gave us, you need to have meaningful employee involvement in developing that plan. If you have a collective bargaining unit in your place of employment, you need to involve them in the development of an alternative plan. I think what we're seeing is most employers, seeing as how there is no current designation of a serious airborne infectious disease, are taking the standard, the templates, the model plan, filling in the blanks, identifying the responsible person, taking the easiest way to develop this plan and putting it on a shelf. Because if you think of what's going to happen, next time we have an infectious disease, airborne infectious disease, that is a serious threat to the public, we're going to get a lot of guidance from the state of New York, just like we did with COVID, about 6 feet social distancing, about masks, about occupancy levels. We're going to get all sorts of information that probably isn't covered in our HERO plan anyway, because we can't anticipate what those are going to be. So I'm recommending to employers to do a plan that works for you. But at this point, I would probably adopt a template, make this as simple as possible with an eye towards knowing that you're going to have to redo these in the future anyway. All right. If you do have a collective bargaining unit, I would suggest you talk to them about it. If you're going to develop your own alternative plan, you have to have meaningful input. What does meaningful mean? It's not defined in the statute. It just means that employees have to participate in the process. It uses language like employers shall consider and incorporate exposure controls, and this is good. This gives the employer the ability to make decisions about this. There are no mandates in these templates that you have to do now. One of our fears was that when the Department of Labor released these templates, it would have put an additional mandate on employers for things like you have to have 150% of the number of masks in the workplace ready to go. There's no mandate for you to go buy anything now, to stockpile anything now, nothing. The only requirement today is that you adopt a plan and communicate it to your employees. You have to review and update when necessary. You'll see in the templates that there are places to put in dates on this. I always tell employers that, how is this going to be enforced, right? But what's going to happen is the Department of Labor is going to come to your place of employment for some other reason. It's going to come there for a workers' comp audit, or it's going to come there because an employee complained about a wage and hour violation or something like that. The Department of Labor is going to ask to see your HERO Act plan. And when they do, I wouldn't want a date on there that is 2 years old, right? You need to have dates that show that you took this plan seriously and you update it and review it from time to time. So let's get our plan in there. Let's get it dated before August 5th. And then let's pull it off the shelf every 6 months or so to review it, update it if we need to, and fix the date in there. So if the Department of Labor comes, they'll see that, oh, good, they look at this. They review this every 6 months. That's good to know. We see people, one of the things you have to put in the plan as a person who's responsible for the plan. One of the most common violations we see is that, the plan comes off the shelf, a regulator looks at it, that person's no longer working here. That in itself is going to be a violation of the HERO Act. So you're going to want to make sure you review and update your plan when necessary. We do not have to submit this plan to anybody in advance, right? This isn't something we have to do today and then send to the Department of Labor, the Department of Health, but it has to be made available upon request to any employee who wants it, any collective bargaining representative who wants it, and the Department of Health and the DOL, if they're in town and they want to see it, you have to provide it. It talks about a verbal review for employees. This is a little complicated. When you read the standard, I think they didn't, we gave them some suggestions. They don't take all our suggestions. One was just a formatting suggestion. They needed to clarify what needs to be done with communication. It says a verbal, what the statute says, and what I think all employers should do, is you should do a verbal review for employees. In addition, the plan must be posted in each work site and included in the employee handbook. By posted in each work site, it means each work site, though you do not have to post it in vehicles. The statute says that specifically. That's good. But it does need to be included in the employee handbook. So what does verbal review mean? I talked to a lawyer, and the example of how helpful they could be sometimes, he said, it means using words. So that's one way to think of it. The test, again, is that your communication is effective. When the Department of Labor comes in to visit you for a workers' comp audit 6 months from now, and they ask for a copy of your HERO plan, you show it to them. They're going to go walk around. They're going to ask employees things. They're going to say, who's responsible for updating your HERO Act plan? And your employees should be able to give the right answers. That's the test as to whether or not your verbal review was effective, right? Where's the plan kept? Who's responsible for keeping it? If your employees can't answer those questions, then you didn't do an adequate verbal review. So can you do it by email? Can you do it through a Zoom or some other format? Yes, you can. The test is going to be how effective you were at doing it. It clearly needs to be posted, and it clearly needs to be referenced in the employee handbook. I don't think you need to print the whole plan in the employee handbook, because you see they're kind of lengthy if you go to the templates. But they need information needs to be in the handbook telling them where they can find it, what it is, and that one exists. Okay. Again, it's only when it's activated on by the Commissioner of Labor, they have some more requirements that are there. Another verbal review, another posting. So if we do have a public health emergency related to an airborne infectious disease, we're going to do more communication to our employees, which is natural. We would have done that anyway. It's required by the statute. There's also a requirement that we give this to all new hires. So anytime a new hire employee is brought on board, we're going to make this part of the onboarding process in terms of giving them a copy of our plan when they're hired. And again, we have to assign responsibility. Someone in your organization, a name is going to go on this plan, and they're responsible for doing all these things. As I mentioned, it gives employers wide latitude in determining what the best route is to take for this. It says the employer shall select and obtain appropriate exposure controls based on the type of level of exposure risk employees have during all activities performed at the work site. So when we talk about engineering controls, we've learned a lot about that in the last year. That my air exchange system is MERV 13 or something. I'm no scientist, but this is the terms that are thrown out there. There's no obligation that you do that. There's no obligation that I have to redo my entire air handling system as a result of a public health emergency. I can consider doing that, but the employer gets to select and obtain the appropriate exposure controls. If I want to, you should, to protect employees. And if you have the resources to do that, then by all means. But we get to determine things like, will we do daily health screenings, right? We don't have to do those anymore. Those are gone from COVID, at least today. Face coverings, physical distancing, hand hygiene facilities. Our plan is going to have to address all those different activities, just like we did for COVID, right? These are all familiar things we've done and learned in the last 18 months. So your plan will have all these activities in there as well. There are protections for employees in the standard in the statute. Of course, one of the things that this was geared towards was employee safety and giving employees a greater voice in determining and creating a safe workplace. This has always been the standard, right? OSHA has always required we maintain a workplace free from hazards. It's always required employee involvement. None of this is new and different. It's just New York State, felt the need to pass a law to do this. You, of course, cannot retaliate against employees for exercising their rights under this plan. Can't discriminate, threaten, retaliate, or take adverse action against an employee for reporting violations, reporting concerns, seeking assistance, refusing to work. This is an interesting provision of the statute. And again, this has always been available to employees as well under OSHA. And the HERO Act has now copied this right for employees. It just added additional, there's penalties associated with it that are different than OSHA. If an employee believes in good faith that the work they're about to do exposes them or their coworkers to, an unreasonable risk of exposure to an airborne infectious disease, they notify the employer of this risk. The employer doesn't address it. That employee and those other employees could refuse to work without retaliation, fear of retaliation under the HERO Act. So if an employee comes to you and expresses, a concern about an exposure, you need to address it. And if we don't, the employee can refuse to work without penalty if they believe in good faith that they were at risk. There's a strange new requirement in this law that talks about records. If an employee comes to you with a complaint under the HERO Act, now the HERO Act became effective July 6th, and there's no current designation of an emergency. So this does not include any communications we're talking about now or over the past 18 months. But in the next emergency, if an employee comes to you with a concern about safety, say they send you an email that says, Bob's not wearing a face mask in the workplace. He's supposed to. It's a violation of the policy. That's an employee expressing a safety concern to you about an airborne infectious disease. Your communication with him, that employee, that initial email, your response, you have to retain for 2 years after the end of the designation of an emergency. So this doesn't include anything we've done over the last 18 months. This is going forward when the next emergency is declared. But keep those records for 2 years after the end of the emergency. And even if an employee comes in and talks to you verbally, stands in your doorway, I'm concerned about this. We got to make notes. We got to say, Bob stopped by on July 28th and wanted to discuss a safety concern regarding airborne infectious disease. And this is how we address it. You have to keep those records for 2 years after the end of the emergency. When we have the next emergency declared, we'll make out a big announcement and big reminder about this, so employers remember to do this. But it'll be part of your plan. You'll see it in there in the plan, the record retention part. Just be aware of it. So that's where we are now. Get your plan done. Copy a template, get it in the binder, get it on a shelf, and wait for the next emergency. Do that by August 5th, which is just a few days from now. And do all your employee communication by Labor Day. So post it as soon as you can, communicate it to employees verbally as soon as you can, and get it in your handbook by Labor Day. Okay. The second shoe to drop here with the HERO Act is a little more complicated. It has a 180-day effective date, which means it's not effective until November 1st. This will be highly dependent on regulations that are generated by the Department of Labor, and they have not done those yet. I talk to the Department of Labor every week, talked to them yesterday about cannabis. Wait till you hear that. Talked to them yesterday, and they said that they haven't even started the rulemaking process yet on workplace safety committees, but they'll be getting to it soon. But what the statute says is that employers with at least 10 employees shall permit employees to establish and administer a joint labor management workplace safety committee. You don't have to go out and affirmatively establish one, but if employees come to you and ask to establish one, we must permit it. 2/3 of the committee must be non-supervisory employees selected by and from non-supervisory employees, and the employer shall not interfere with the selection of employees who serve on the committee. This is concerning. There are federal laws now about protecting employees who engage in protected concerted activities regarding things in the workplace. It's the National Labor Relations Act that protects employees who want to organize unions, right? So if 2 employees get together, 2 or more, and they have a safety concern, they come to the employer with those concerns. There are now protections in place for them at the federal level. So let's say we have 25 employees. 2 of our employees come to us and they want to be our workplace safety committee. And your first reaction is, are you kidding? You're my 2 worst employees. Why would I have you be my workplace safety committee? It's very likely that you may have stepped on the National Labor Relations Act already in doing that by retaliating against these individuals for protected concerted activity. So how the federal law and how the state law are going to work, there are still lots of questions. What if these 2 employees come and want to be your committee, and then 3 other employees come and want to be your committee? How is that going to be resolved if we cannot interfere with the selection of employees who serve on the committee? Are there going to be elections held to determine who our committee is? Who supervises elections conducted by employees? Do they use our email system? There's a lot of things there that, again, go into federal law regarding union organizing and could be a problem in contrary to the HERO Act. The Department of Labor will be promulgating rules and regulations. We'll be working with them to do this so that employers do not have all sorts of liability regarding how this committee is established. Again, members of the committee are going to have protection from retaliation for participating in the committee. They have a wide range of authority under the statute. We have a lot of problems with this. This was our major concern when we tried to get the bill vetoed. But frankly, the governor said he's not going to veto anything that has the word HERO in it, even though they acknowledged that it was a bad law. The committee, according to the statute, has the ability to raise health and safety concerns to which the employer must respond. We assume that is only related to airborne infectious disease. We're going to look for clarification of that. Review the adoption of any policy in the workplace regarding employee safety. That seems very broad, right? What if we work 8-hour days and we decide we're going to start working 10-hour days? Is that a employee safety issue? Does this committee have the ability to review this policy? We are going to obviously focus on narrowing the scope of the type of policies they can look at to only those involving airborne infectious disease. Participate in any site visit by any governmental entity. They're already able to do that under OSHA. Review any report filed by the employer related to health and safety in the workplace. Again, we have concerns with that. Those of you who are obligated to do OSHA 300 reporting know that the 300 report has employee-specific information on there regarding injuries in the workplace. This committee should have no access to that information. We're going to make sure that happens as part of the rule-making process. They can regularly schedule a meeting during working hours at least once a quarter and get paid for it, not to exceed 2 hours. So this committee can schedule meetings, and they can attend training without loss of pay on the role and function of safety committees for up to 4 hours. We don't know if that's once a year or once a lifetime. Regulations will have to clarify that. But as you can see, there's a pretty wide scope of authority this committee has. This, as you can see, why is now the most concerning part of the HERO Act. And we just have to wait. We'll have to do another one of these as the regulations come out and give us some guidance on how to handle these committees. So that's what's next. We're waiting for regulations from the Department of Labor, and this happens every time a law is passed. The law is passed, and it gives the authority to the Commissioner of Labor to promulgate rules and regulations. This is where the Business Council, I'll have a lot of input into those on how to implement these standards and how to implement these workplace safety committees. But your immediate goal here is to get your plan adopted, get a plan adopted. And by the way, there's no specific definition for what adoption means. You don't need to have a resolution from the board. You don't need to, any sort of membership vote if you're that kind of organization. Adopt this policy like you adopt any other policy, your sick policy or your, time off policy. But then let's get it communicated to employees. Hey, employees, we have a new plan. It's available here. Here's the person in charge of it. You'll see it posted on the bulletin boards. You'll see it in the employee handbook. Those are our immediate obligations. So get ready to do that. And I'll stop here and take some questions and see if we can help you with that way. Laura, if you're still there.
I'm still here, Frank. Thank you so much. A lot of great information and a lot to take in. We did have some questions come through. Frank, can you talk a little bit about the differentiation with 10 employees? And is that just related to the Workplace Safety Committee? What is the employee number as it relates to the specifics of this act?
Good question. The standards and adopting a plan applies to everybody, all employers. If you have one or more employees, you need to have a HERO Act Airborne Infectious Disease Plan on file. The Workplace Safety Committees only apply to those with at least 10 employees. Again, we're going to clarify what that means. But all employers have to adopt a HERO Act Airborne Infectious Disease Plan.
Great. Thank you for that clarification. And in the chat, there was also the question about where you can find the HERO Act templates. I did include in the chat feature there that they are found on the New York State Department of Labor website.
Yep.
And the specific link there is dol.ny.gov/NY-HERO-Act. So if you don't see the chat, that is the link to the Department of Labor website for you.
And Laura, I'll get you my slides and you can distribute those as you like. And it has that link on the slides as well.
Fantastic. So that looks like it was all the questions that, we have something in the chat here. We do have one, Frank, that what are the rules for notifying seasonal employees?
Yeah, there's no distinction in the HERO Act among what we call employees, right? Temporary, per diem, seasonal. They have to be able to answer those questions if the Department of Labor asked them, right? So if they came in and they asked one of your summer employees who's in charge of the HERO Act, they're going to have to know. So there's no specific rule on how to do that, but you have to communicate it to them somehow. So however you communicate things to those employees regularly, you have to include the HERO Act in that. So nothing specific. They don't make any distinction between those types of employees. So it's up to us to make sure we effectively communicate to them however we do it normally. If we do it by text or email or whatever, the HERO Act and provisions have to be included.
Great. Thanks. That was a great question.
Mm-hmm.
And we have a question of what is ETS?
Emergency Temporary Standard. And so what OSHA does, OSHA develops standards. Those are OSHA laws. They carry the weight of law. To develop a standard takes a long time. They have to go through the comment period and all that. It takes months and months and months for OSHA to do a standard. They can do emergency temporary standards that carry the weight of law. And they did that for COVID, for healthcare. And that was published on 6/21, which means it becomes effective immediately. They're going to go through the comment period and all that eventually, but effective immediately, healthcare employers are covered by the emergency temporary standard. And those provisions include a written plan if you have 10 or more employees. So the HERO Act doesn't cover people who are covered by the emergency temporary standard. It's complicated, I get it, but the bottom line is you have to write a plan for your employees if you're in healthcare, and it has to incorporate the components of both the emergency temporary standard and the HERO Act.
Okay. We have another question that says, and do you know if will the HERO templates be provided in other languages?
Yeah, the department indicated that they were going to provide those in the languages they normally do, and there's a long list of those. I haven't seen those yet, and I didn't check the website today. One of the other issues is it's on there as a PDF, I think, and employers are looking for it in Word version so they can, cut and paste and put their name in there, which would be great. And I didn't see if that was up there yet today. If it's not, I'll remind them again because that's a pain in the neck.
Great. Any other questions out there? I don't see any in the chat or in the Q&A. So what we will do at this point, Frank, thank you again for this great information, for providing the slide deck. Folks, we will email that out along with this presentation to you. And we will go back into present mode. Frank, when you come back in, just double click on a table out in the main area, and you can join Frank at his table if you have any specific questions that you would like addressed one-on-one. And thanks again, Frank, and thanks for everybody for joining us.
Okay, thank you.